Good morning, student. How are you? I hope everyone is happy. God bless you and your family. I welcome everyone back to my class. Today we are going to discuss about common disorder of the urinary system. Disorder of the urinary system can affect the kidneys, the ureter, the urinary bladder, or the urethra. They may be caused by infection, injury to the urinary system, or inherited conditions. Other diseases or condition, for example, diabetes and high blood pressure. Diabetes has led to the death and disability of millions of people worldwide. You or someone you know may be suffering from this chronic illness. Chronic illness means are defined broadly as conditions that last 1 year or more than require ongoing medical attention or limit activity of daily living or birth. Chronic diseases such as the heart disease, cancer, and diabetes are the leading causes of death. The bad things about diabetes that is cannot be cured. However, the good things about diabetes is that you have the ability to control it. The illness is caused by an imbalance between the insulin. Insulin means a substance normally produced by the body itself, which control the amount of sugar in the blood and blood sugar inside of a person's body. Insulin it's produced by the pancreas. Each person pancreas has the job of the balancing how much insulin to allow into the body depending on the amount of sugar that is the blood. When a person has a diabetes, thought here it's a problem with the pancreas and the insulin blood sugar balance. And women and men has too much blood sugar and not enough insulin. Usually diabetes occurs when the pancreas begin to become resistant to releasing insulin because of lifestyle factor such as eating high fat diet. Sometimes thought a person is born with diabetes and will live his or her entire life without having the natural insulin needed. First one types 1 diabetes, type 2 diabetes and gestational diabetes. Type 1 diabetes. You may have a friend or family members who has with diabetes for his or her entire life. This would be considered type 1 diabetes and it is the genetic. It occurs when a person pancreas does not work correctly from birth. This is type 1 diabetes. So, due to this, the person must take insulin therapy every day. Type 1 diabetes will be with a person forever. Weight deposit common belief does not matter. Next, type 2 diabetes. There are the countless people who led normal lives and after many years find that their pancreas begin to change the amount of insulin it release into the blood to keep the insulin sugar balance correct or that the body become resistant to the insulin secreted by the pancreas. This is type 2 diabetes. Next one, gestational diabetes. Another form of diabetes is gestational diabetes, which occur when a woman develop diabetes during pregnancy. Like type 2 diabetes, there is no known causes, but the scientists strongly believe that is form of diabetes due to hormone in the unborn baby placenta blocking the release of insulin from the mother's pancreas. Over the course of the pregnancy, There is an imbalance between the insulin and the sugar in the blood of the mother. After the baby is delivered, the gestational diabetes will normally disappear. However, it has been found that is if you had gestational diabetes during your first pregnancy, you have 66 percentage greater chance of developing this condition with the future pregnancy than mother who never had diabetes. Diabetes treatment and prevention. The healthy diet and exercise routine is an important part of treatment for all types of diabetes. Next, we will discuss about high blood pressure. When you go to the doctor, even for something complete unrelated, the nurse or medical assistant will usually take measure your blood pressure or the force with your blood push against your arteries. You get the cuff around your upper arm. It skews you really tightly, and then you get two numbers and either a frown or a pat on the back for a job well done from your healthcare provider. Having high blood pressure is a risk factor for a number of serious health problems. One in three Americans has high blood pressure, and yet it is fairly easy to prevent and control. This is why your doctor will keep measuring and monitoring your blood pressure. So, what is high blood pressure? The official medical term for having high blood pressure is hypertension. Listen, high blood pressure means the official medical term for having high blood pressure is hypertension. Blood pressure is caused by the pumping of your heart but can be affected by a number of lifestyle factors like diet. Blood pressure is measured with the two numbers. One is your systolic pressure and second one is diastolic pressure. First one, systolic pressure. The pressure of your blood exerted during the heartbeat. The pressure exerted in between the heartbeat called diastolic pressure. When you get a blood pressure reading, it shows the number of systolic pressure over the number of diastolic pressure. The reading for normal blood pressure is anything below 120 by 80. Your doctor will consider you to be borderline or pre-hypertensive. If your reading it's between 120 by 18 and 139 by 89, measurement between 140 by 90 and 159 by 99 mean you have stage 1 hypertension, and anything over that range is stage 2. Next, symptoms of hypertension. One of the most important reason that your doctor measure your blood pressure every time you come in for the checkup is that you may never know you have hypertension until you see a high reading. Most people with the hypertension do not experience any symptoms because of it. Rarely you may get headache, nose bleeds. Some things the symptoms are highly unlikely until blood pressure has reached the several level. Next topic, urinary tract infection. So what is a urinary tract infections? What is a urinary tract infection? Urinary tract infection, commonly referred to as a UTI. U mean urinary, T tract, I for infection. Okay, so urinary tract infection. So urinary tract infection is an infections that affect the organs and structure in the body that are responsible for the passing of urine, such as the bladder, kidney, ureter, and urethra. So the urinary tract infection, the first one, lower urinary tract infection involve the bladder and may also be called simple cyst. Second one, upper. Upper urinary tract infection involve the kidney and are also known as pyelonephritis. While a urinary tract infection can happen to anyone, there are some things that can increase your risk of contracting one. Cystitis means an infection, especially in women, of the organ in which liquid waste collect before the leaving the body that make it painful to go to the toilet. Causes and risk factors. Urinary tract infections are caused by bacteria. They enter the urinary system through the urethra and can travel upward to the bladder and kidneys. Most common organism that causes urinary tract infection is Escherichia coli bacteria, E. coli. It is normally found in the lower colon but sometimes can find its way to the urinary tract. Women have more urinary tract infection than men. And as women get older, then risk gets higher. There are a few train of thought about is some believe that since women have a shorter urethra, bacteria can enter the urinary tract and travel up to the bladder more quickly. Symptoms of urinary tract infection. The irritation things about urinary tract, if they often don't cause symptoms right away. While some people immediately recognize there's some things it's wrong, some never even know they have one. Lower urinary tract infection can cause a frequent, urgent need to urinate, pain or burning while urinating, urine that is cloudy in appearance. Normal urine is usually straw colored and clear. So, blood in the urine and urine with a strong odor. Upper urine have all of those some symptoms but may also include chills, fever, vomiting, and pain in the upper back area. The second one, urinary tract. Urinary tract is a closed system of organ that is responsible for forming urine by filtering waste and excess water and electrolytes from the blood. Our urinary tract start with the kidney and then goes to the ureter, bladder and the urethra. The tract end at the exit or urinary meters. Now that we know the structure of the urinary system, we are going to look at a few problems that can happen. Stone in the tract. One possible causes of problem in the urinary tract is the presence of the stone in the tract. This or deposit of calcium and other minerals that build up and crystallize. Crystallize means to become clear and fixed. The name of the conditions of having stones is different and the symptoms may vary slightly depending on the where in the tract and the stone are located. The condition of stone in the kidneys may be called nephrolithiasis or renal calculi. You will see this used in interchangeable for kidney stone. The actual kidney stone is called the nephrolith. Some symptoms of nephrolithiasis include pain, bloody urine, and distension of the kidney known as nephroptosis. Nephroptosis seen due to the retention of fluid in the kidney is called hydronephrosis. Once this occurs, the urine has a very difficult time flowing through the rest of the system to excrete it from the body. It is possible that the kidney stone may become dislodged and start to move onto the next part of the urinary tract, which is the ureters. A stone in the ureter is called a ureter lith and causes the condition of the kidney stone in the ureter that we refer to ureterolithiasis. This condition may cause bloody urine, decrease urination and pain. The stone may get stuck in the ureter or it may continue to move through the tract. If does not get stuck, then distensions of the ureter called uretroptasis may occur. Hydroureter is another symptom seen in this condition. This is when fluid is retained in the uterus. Today I give 10 hard words. First one diabetes, second one blood pressure, third one Escherichia coli, fourth one urethra, fifth one urinary bladder, sixth one urinary tract, seventh one kidney stone, eighth one disorder, ninth one inherited, tenth one insufficient. Today biology assignment, learn, answer the following. Thank you.